Have you ever wondered if a simple test could reveal your risk of a heart attack before symptoms appear? In today's video, we'll explore the simple tests doctors use to assess heart health, what the results may mean, and the lifestyle changes that can help lower your risk. Let's get started. Heart attacks remain one of the leading causes of death worldwide, but they rarely happen without risk factors developing over time. While no single test can predict exactly when or if a heart attack will occur, several quick and simple assessments can provide valuable information about your heart health. One of the easiest is checking your resting heart rate. When combined with other routine health screenings, it can help identify people who may be at a higher risk of cardiovascular disease, allowing them to take preventive steps before serious problems develop. Resting heart rate. A simple yet valuable indicator. Your resting heart rate is the number of times your heart beats per minute while your body is completely at rest. For most healthy adults, a normal resting heart rate falls between 60 and 100 beats per minute. People who exercise regularly often have resting heart rates between 40 and 60 beats per minute, reflecting a stronger and more efficient heart. Measuring your resting heart rate is easy. Sit quietly for at least 5 minutes or check it immediately after waking up. Place 2 fingers on your wrist or the side of your neck where you can feel your pulse. Count the beats for 30 seconds and multiply by 2, or count for a full minute for greater accuracy. A consistently elevated resting heart rate may suggest that the heart is working harder than normal. Research has shown that people with higher resting heart rates tend to have an increased risk of heart disease, heart attacks, and early death. Although a high heart rate does not directly cause a heart attack, it can signal poor cardiovascular fitness, chronic stress, inflammation, or other underlying health problems. Blood pressure. The silent warning sign. Another quick and essential test is measuring your blood pressure. High blood pressure is often called the silent killer, because it usually causes no symptoms while slowly damaging blood vessels and the heart. Normal blood pressure is generally considered to be below 120/80ths of a millimeter of mercury. Readings that remain consistently elevated should be evaluated by a healthcare provider. Over time, high blood pressure forces the heart to pump harder, causing damage to artery walls and increasing the risk of plaque buildup. This greatly raises the likelihood of heart attacks, strokes, and heart failure. Regular blood pressure checks allow problems to be detected early, often before symptoms appear. Cholesterol test. Looking inside your arteries. A simple blood test that measures cholesterol levels can provide valuable information about your heart attack risk. LDL cholesterol, often called bad cholesterol, can accumulate inside artery walls, forming fatty plaques that narrow blood vessels. HDL cholesterol, known as good cholesterol, helps remove excess cholesterol from the bloodstream. When plaque becomes unstable and ruptures, a blood clot can form, blocking blood flow to the heart and triggering a heart attack. Monitoring cholesterol levels allows healthcare providers to recommend dietary changes, exercise, or medications when necessary. Blood sugar screening. Checking your blood sugar is another quick assessment that may reveal hidden cardiovascular risk. People with diabetes or prediabetes often have damage occurring inside their blood vessels long before symptoms develop. High blood sugar contributes to inflammation, stiffens arteries, and accelerates plaque formation. Because diabetes significantly increases the risk of heart attack, regular screening is especially important for individuals who are overweight, have a family history of diabetes, or are over the age of 45. Coronary artery calcium (CAC) scan. For individuals with moderate cardiovascular risk, doctors may recommend a coronary artery calcium (CAC) scan. This specialized CT scan detects calcium deposits inside the coronary arteries. The amount of calcium present provides an estimate of plaque buildup. A higher calcium score generally indicates a greater risk of future heart attacks, while a score of 0 often suggests a lower short-term risk. Although this scan is not necessary for everyone, it can be useful when doctors need additional information to guide treatment decisions. Lifestyle still matters most. Even the best screening tests cannot replace healthy daily habits. Regular physical activity strengthens the heart muscle, lowers resting heart rate, improves blood pressure, and supports healthy cholesterol levels. A diet rich in vegetables, fruits, whole grains, beans, fish, nuts, and healthy fats helps protect blood vessels and reduce inflammation. Avoiding smoking is equally important. Tobacco damages artery walls, increases blood clot formation, and dramatically raises the risk of heart attack. Quitting smoking provides immediate cardiovascular benefits that continue to improve over time. Managing stress, maintaining a healthy weight, getting enough sleep, and limiting excessive alcohol intake also play important roles in protecting heart health. No quick test can predict with complete certainty whether someone will have a heart attack. However, simple assessments such as measuring your resting heart rate, checking your blood pressure, testing cholesterol and blood sugar levels, and, when appropriate, undergoing a coronary artery calcium scan can provide valuable insight into your cardiovascular health. The key is not to wait for symptoms to appear. Regular health screenings, combined with healthy lifestyle choices and routine medical care, offer the best opportunity to identify risks early and reduce the likelihood of a future heart attack. Knowing your numbers today could help protect your heart for years to come.